Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, and welcome back to the Our Forever Smiles Cleft Mom Diaries and Support podcast. I am so excited to continue our ACPA series. We have so many wonderful professionals here that I feel like a lot of people that have come on the podcast have been affected by the cleft journey, whether that's through a family member or themselves, but also amazing professionals. Suzie Santomieri is here today. Suzie, right? Suzie is not only a cleft mom, but she is also a care coordinator, right?
Yes.
So how did you, well, obviously we have tons of interest in your journey as a cleft mom. I have been here for a few days now, for 2 or 3 days now, and I feel like I've known Suzie, like, we just like
I know, we've been
fast friends, you know, like I see her and it's just like that connection that we've had. We've also talked online quite a bit. And so of course I've always been interested in your journey as a cleft mom. It's like the first reason why I reached out to you, but I think it's also really interesting that you've been able to work with a team, right? And kind of see how teams are approaching different cases and just being able to kind of manage that whole system, right? And to obviously improve it. Like you've had opportunities to be able to do that. So I am gonna first start with your specific case, right? Because Dominic is your cleft affected child.
He is, yes. He's about to be 5 in a couple weeks. He was born with a unilateral cleft lip and palate.
So what was that like first learning about Dominic's cleft?
Got his diagnosis prenatally at the 19-20 week ultrasound. We talked a little bit before we started recording, but there is a family history for me on my biological dad's side. We have several family members that are cleft affected. And I honestly did not think that would happen for us. It wasn't something that was even in my wheelhouse. I went there thinking that, just everything was going to be normal, just like the previous ultrasound I had with my oldest son, Nicholas. So it was very different day for me, very emotional, as you can relate to. And I know you didn't get your diagnosis prenatally, but I think we all go through that like grievance process when we learn that things are going to be different for our children. So that's sort of how it all started. And it was 2020, so we were like smack dab in pandemic, and so I didn't get to meet our provider in person. Everything was virtual. I didn't get to have family there when we delivered. It was just me and my husband. So the support system was really limited. Family couldn't come see us after because, everybody was just terrified of COVID and, didn't want my children getting sick. So I do think that my situation was pretty unique and a little bit harder to navigate that process of like getting a cleft diagnosis and then having a child born with a cleft. And, when you see your baby that's born with a cleft, especially a cleft lip, that's significantly, wider than others. It's really scary. And, when I delivered him and they put him on me, I didn't see him right away because, they like tuck them in really close to you. And I was like, I was almost getting like aggressive with the doctors. And I just kept saying like, I need to see him. Like, I need to see him, like pick him up. I need to see what he looks like. And I just remember like my husband was crying and he was just like, it's just much wider than we thought. It's a little bit worse than we thought, but it's going to be fine. And I remember seeing him, it just felt like crash. Like everything around was just, I just wanted everybody out. I wanted everybody away. I wanted to just kind of like be in my grief. And it's interesting how quickly that like subsides. Like you see it, you're like, okay, this is what we're working with. This is going to be our journey. This is going to be his journey. And then you just start doing everything that you're supposed to be doing. And they're cleft, all like the little tongue flicks that comes out. Like there's just so many little things that I think that moms understand that people don't really truly understand and can appreciate. All those things just become like your normal. Like I hate saying that, but your new normal. So yeah, that's sort of how everything started for us as far as the diagnosis and the birth and all that.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Darn Media Integrated Marketing Agency. Sienna Darn Media is more than just a marketing agency. They are your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennadawnmedia.com. How were you able to navigate feeding with Dominic?
We were really lucky. He was 8 pounds, 12 ounces when he was born. He was a big boy. And we didn't have any issues feeding. So we used the Dr. Brown's. Lactation at Wake is excellent. And the feeding specialist, inpatient speech, they're amazing. Like the team I could not rave more about. They're so great. And they were there like within the hour of me giving birth. They supported me. The lactation specialist that came in actually went to college with me, and I had no idea. And she walked in and she was like, Suzie, like it was just so great to like, I was very relieved to like know somebody and then also just have a good team. So yeah, he did good. I breastfed or I pumped. The breastfeeding journey was not in our cards, but I got to pump for 11 months. And yeah, he did the Dr. Brown's with the specialty valve, and he ate like a champ. We started taping right away and did interventions right away. And then we eventually did NAM, which I do think also helped with feeding.
Yeah. How were you able to navigate? Oh, you think the NAM helped with feeding?
Yeah, I do.
Wow.
Yeah, because the purpose of the NAM, obviously it's moving the segments closer together because his cleft was very wide. His gums were very far apart. But, you're giving your child that intact palate that they are not born with. So it is really helpful to give them a little bit more assistance. And I know that NAM is not for everybody, and it is probably a very touchy subject among moms. Those that had it and used it and were successful with it, like they rave about it and love it. And then those that had a harder journey with it, they're like, you don't have to have it. I can see it both ways. And working in the hospital now, like we have the advantage of having a pediatric dentist on our team that does it, and not every cleft team does. So I try to, tell families this is an intervention that not everybody gets to have for their kids. I don't think it's like you have to have it, but why not give it a go if you can?
Yeah, for sure. I agree with that. And I think that, if parents are struggling with it, they should express what their struggles are with it, be transparent and honest with their teams.
Yeah.
So that your team can make adjustments or help you throughout that journey.
Yeah.
And so through his lip repair and palate repair, he's been consistently with the same team, correct?
Yes, same team.
Yeah. How were you able to sort of navigate both of those surgeries, and what were your feelings around the surgeries?
First surgery, I think, was recovery-wise, it was not terrible. We were in the hospital for one night. He had his lip repaired. So back in 2020, when he had his lip repair, Dr. Runyon, who is his surgeon, he was not doing like cleft rhinoplasties with primary lip repairs. He has since evolved his practice, and he does do rhinoplasty now with lip repair. So it is like Dominic's surgical journey was a little different than kind of how he approaches surgeries now. So I do think that recovery was a little bit better. Palate repair was not so great.
So what made it more difficult?
Palate repair was not so great because he was not wanting to eat after surgery. So we were in there, I think, for 3 nights, almost 4 full days. And he was miserable. He was in a ton of pain. We were having to do a lot of pain management, and he just wanted no parts of sippy cup, open cup, pouches, pudding. I pulled out all the stops because, most teams want your baby off a bottle before palate repair. And that's asking a lot since most of them are not even a year old yet. So we're like jumping up their timeline and, what typical babies are used to. And a lot of babies at 11, 12 months, they don't want a sippy cup and they don't want an open cup and they don't want a syringe. So it was not the best recovery for us. But we made it. We got home. He did lose quite a bit of weight from that surgery.
Do you remember how you were finally able to get him to eat? Because I think a lot of families struggle with that same, they're just not expecting it.
Right.
I tell people all the time, people freak out about having to wean their baby. And I'm like,
yes, they do.
Your baby probably not going to want anything to do with that bottle anyway. Like you're probably going to struggle to feed them
anyway
in any capacity. Yeah. And so it is one of those things where it's like, don't stress out so much about the weaning and kind of focus on how you can get your baby to feed after repair. And so what was the trick that worked for Dominic?
I think after like day 2, we started doing like vanilla pudding. And what I was doing is I was putting my milk in the pudding to kind of fatten it up even more. And then I was putting formula in I was like throwing it all in there to give him as much calorie intake as I possibly could. And eventually he would do I have the sweetest video ever. I'm like standing in front of a mirror, like videoing him. And he's just like, we're just little tiny spoonfuls. And he's got pudding all over his mouth. And he's got the bloody crustiness. And it was terrible. But I was like, so sleep deprived, but so happy because I'm like, yes, please just keep eating this pudding. That's all I want you to do. I'll give you whatever you want. I think of families, and this is like cleft coordinator role, not mom role. I think families feel like targeted when you ask them to take their child off a bottle. I think they look at you like you're crazy and like, I can't do that. It's not possible. Like, we're going to struggle. What are your tricks? Consistency is the absolute biggest thing I can tell families. You are not going to get your baby off all the bottles by palate repair. I don't know a single family that's been able to do that. And I am very transparent with the moms and the dads. I'm like, we're asking a lot of you. If you can take away 2 out of the 4 bottles a day that you're giving them by that point, that's a win. Nighttime bottle, morning bottle, those are the hardest ones. But if you can increase your pouches, your purees, your oatmeal, if you can increase all of that over the course of, I would say a month and a half before palate repair, you're going to fill baby up and they're not going to want those bottles during the day. So if you can get down to 2 bottles, that's ideal. And then you're really going to be syringing for many days after.
I agree with that as well, because what we didn't wean. I mean, it's just like what you said, right? Like we weren't able to successfully wean her off of the bottles, but we got her to a point where we were at least able to use open cup. So she was familiar with open cup. She could drink from open cup. And so with that, it's like whenever we were trying to feed her after palate repair, she wasn't like a new concept for her. And so even that is like a win, just teaching them to use or to feed with another method like a pouch or, open cup or even a syringe or I know they have like the spoon feeders too that also work. And so that's fascinating, but you talk a little bit about kind of Dominic's journey and also as your role as a care coordinator, right? What do you think has been the differences in the way that you approached or the approach to Dominic's care or the way that your care was coordinated, right?
Yeah.
When Dominic was a patient going through those surgeries and that type of thing in those early years versus what you're doing now? Like what changes or things that have you done?
I think ACPA honestly has helped so much because I come to these meetings and I get to hear what other teams are doing. And yes, I am a mom role, but also, and I like to say that definitely helps me better in this role for sure, because it does give me a 1-up and I am able to give them personal experience on things that I've dealt with. But it's very good to come to these meetings and see what other teams are doing, their approaches. And I pull and pick every single year. And I feel like our practice evolves from just little tiny tweaks. So when I feel like when I go into a room, it's different because, you have babies they're born in the first year or 2, we're seeing them constantly. I mean, they're in the hospital, every couple of months, seeing all the specialists. When baby hits 3, things slow down pretty exponentially, which is so wonderful. I'm like, I always tell parents, I'm like, there is a light. I promise you, we are best friends right now and we'll be best friends forever, but we will not see each other at this much when baby is 3. It'll be a once a year and we can say hello and you can leave for a year and it will be great. So I do think things look differently with how I deal with parents in those early years than, when they're 3 and up, because treatment looks different and where they are in their cleft journey looks different. But I think giving families the resources early on and just being like available. A lot of my families, which is, probably most professionals would like smack my hand. A lot of my families have my cell phone number. I do think it's important. I think most of our families are pretty respectful about my time and they don't text me at, 11 o'clock at night when I'm with my family. But, I think being available to help them when they're freaking out about taping or, is this stitch supposed to be here? Is this going to dissolve? Feeding, all of those things. I think all of it's really important. So approaching them with being like, you can talk to me at any time. You can email me at any time is extremely important because a lot of parents don't want to bother the provider because they know they're busy. So I do think that helps a lot. And then with the older kids, like I try to talk to the kids more so than I talk to the parents because I feel like it's extremely important for them to understand that they are their own advocate. This is their journey. This is their medical journey. Parents, and we can have a conversation, but when I'm in the room and I'm talking about their schedule, I'm talking about their day, I'm asking him, how are your ears doing? Are you having drainage? Do you need to see ENT today? How's school going? Like I'm talking to the patient because I think that is important. And I don't want parents to be offended by that. Like I'm ignoring them, but I think the most important thing for us as moms and our spouses and partners to realize is that, our kids are going to have to speak up for themselves. They're going to have to be present in their decision-making and their appointments. And I think that starts at a young age.
Yeah. I've had someone that is cleft affected on the podcast. His name is Scott Crampton. He was actually on Shark Tank. Oh. Yeah. And he mentioned that. He said a lot of like the appointments that he went to as a child, it was a lot of people talking about him while he was in the room. And it was like sort of like this weird thing. And of course, sometimes when you're young enough, right, you do have to like talk to the parent, but it's including them in those conversations that is so critical and important. I think, there are adult conversations, right? That decisions that mom is going to have to make. And of course she's going to need to be in the know and that type of thing, but just like checking in, like making sure like, hey, asking about how school is going, asking the questions that they can answer themselves is just great. I love that approach. How'd you become the care coordinator? It's like patient to care coordinator.
Just a blessing, honestly. So I was a special education teacher for many years. That's what I did by trade. And after Dominic was born, we had his lip repair, his palate repair in summer of 2021. And it was summer and I was off and not really feeling great about the school system, just, with COVID and where things were at and not feeling a lot of support in my role. And Dr. Runyon just happened to text me and ask if I was available to take a call. He told me that the current coordinator was leaving and moving away and asked if I would like to interview for the position. I was like, I'm not a nurse. I'm not a medical professional in any capacity.
Are they usually medical?
Yes. I think it's gotten a little different over the last probably like 2 or 3 years for sure, but most coordinators in cleft teams are speech pathologists or nurses, or they do have some medical role, that they had in the team, because a lot of teams just aren't that big. And so they do cleft clinic days and they're a nurse, and then they do their, nurse roles the other days. So yeah, it looked a little different. And he said, well, I know that. I just think that we're looking for like a parent perspective in this role. I think it would be very helpful. Families can, relate, and it will be something different than what we've had before. And so I ended up, interviewing with Dr. David and Dr. Runyon, and then I got the job. And I just, I loved teaching, and I loved my students. I taught, students with autism and Down syndrome and, pretty significant disabilities. And I miss them, and I miss the parents. I just don't miss like all that came with it, the system, the paperwork, all that stuff that came with it. The really hard part of it that you don't get a lot of support with. So I feel like I never, ever want to leave.
Yeah, I love that all. Yes. What's like a commonly misunderstood aspect of your role that you wish like parents or even providers knew?
I think just being here, I think the providers truly know how important their coordinators are.
Like, I hope they know.
Yeah. In other roles, you probably see people that are like underneath of the big dogs, and, they don't get a lot of appreciation. I don't think coordinators feel that way. I think that the providers know, that they are very important in making their lives easier and making patient lives easier. So I do think that that's, not something that many of us have to deal with. I'm not going to speak for everybody, but I am very blessed because our director and, Dr. Runyon, they're amazing providers. So I don't really know if that, I'm trying to think of like something.
Yeah, no, I mean, if I appreciate that though, because I think that, it is often like the sort of viewed as maybe like this admin type of like thing. But there's also so much more to that. And I think that maybe it's not the providers that think that like, hey, you're just the person that answers the phone. It's more like probably like the parents, because the providers know like, hey, this is the person that's going to kind of make this world go round, and they understand the patients deeply.
Yes.
And so, but that is nice to hear. It's refreshing to hear that the providers do appreciate that role and they understand the importance of it, because I do also know teams that don't have care coordinators.
Yeah, and I don't even know how they go round. I have no idea. Those teams must be like superhuman or something. I don't know. I think that, we are obviously like the middleman between everything. And, we do deal with, some families and parents that they want answers right away. They want things done quickly. They want it explained. They, sometimes think that they are our only patient. Saying that as kindly as I can. And, that's just not reality. And, I have to like white glove that a little bit and try to help them understand, we see a lot of families, and your child is like the most important thing to you. And you're doing your job as a parent, right? You're fighting for, advocates, and you're advocating, and I appreciate all of that. But, I also now see the flip side of what the providers have to deal with, and they see hundreds and thousands of patients. And not that anybody is more or less important, but navigating that is very difficult. And I think people, unless you have ever been in the medical field, don't truly understand how hard that is to navigate.
What are like common questions that you get from parents? Like they just call you and ask you, maybe in the beginning or even just generally?
Yeah, in the beginning, it's kind of like, what is this going to look like for us? And that's a hard question because everybody's journey is different. You can have a cleft lip and palate and have no feeding issues. You can have a cleft lip and palate and your baby could have a feeding tube. You just don't really know. So I do get a lot of feeding questions in the beginning, and I always, I err on the side of caution. I'm not a speech therapist. I'm not a feeding therapist. I can tell you, what our team recommends. And then I always, provide them with Jennifer, who's our SLP, and, make sure that they're in communication with her when it comes to those questions. But I think like taping is the biggest questions in the beginning. Like, are they taping correctly? If there's NAM, I become very close with our NAM families because it's, I'm seeing them every 2 weeks with our pediatric dentist. And that's a labor of love. NAM is a labor of love, and it is hard. And families need a lot. They need a lot of support when doing that journey. So, we try to to be that support as much as we can. And then I think, just timing of surgery, everybody wants to know like how early the first repair is going to be, what that second repair is going to look like if it's needed. And, when the team visits start. So I do, there's a lot of questions in the beginning that we try to, navigate for families. And I welcome them. There's things that they want to talk to the doctor about, and there's not a lot of time when they're in the room. And so I'm kind of like the follow-up person for that.
So like being here at ACPA, right, there's so much like innovation, studies, new research coming out all the time. And so what do you think has been like the latest and greatest that has like come out recently that has kind of wowed you a little bit?
I think they're trying to do a lot of like AI type things, and really it's over my head. I'm not even going to touch on it, honestly. But I think that there's just advances every year. Like there's not new techniques, but like older techniques that are established that are kind of getting brought back into practice. Yeah. And I think different surgeons, this field, even though to us it's like big, it's very specialized. And all these, especially the surgeons, they all know each other very well. And they all, see each other at the conferences, and they're in communication with each other about like specific cases and techniques. And, they go away and they're like, oh, I'm doing this technique now for palate repair, or I'm doing this technique now for lip repair. And sometimes they backtrack and they're like, oh, maybe I'll start trying that again, or maybe I'll try this again. And I think that, it's kind of like a merry-go-round where they just kind of go around and see like what they truly think is working. And I like that. I like that, they do have established techniques and procedures, and they're willing to not just stick to the same thing all the time. I like that they're willing to consult with other people and see what's working for them.
Yeah, I love that. If you could rewrite one part of the cleft care experience for families, whether that is the way that it is delivered, explained, or supported, what would it be?
I would say the delivery from the very beginning. I think that at no fault of their own, like at an OB office, that is probably where moms are the most sad, and they are the most blindsided. And they are basically just trying to navigate this mother's emotions, and not like in an ugly way, but like get them out the door and to where they need to go to feel better. And I think that, my OB was great and ended up calling me like two or 3 days after we got the diagnosis. And he like talked me off the ledge. I mean, he really did. He made me feel so much better about what our journey was going to look like. But I don't think that happens everywhere. It just doesn't. I think that, when you think about a pregnancy, you're seeing different, in most practices, you're seeing different providers. Each time that you go in for an OB appointment, they want you to see who they have in the practice. If it's 1, 2, 3, 4, 5 providers, they want you to switch and rotate. And so it's hard when you go in there and you might not be with the person that you think is going to deliver your baby, and they're giving you this news that now something is going to be different. And I think that for me, besides like actually giving birth and the sadness that came when I gave birth, that moment was probably like the ugliest moment for me. I was inconsolable, saying a lot of bad words and crying a lot of tears in the OB's office. And my OB was wonderful, but I was not handed like a packet or a visual aid, or I was not, Like I was not given any educational materials from like that moment. It was like, oh, we're going to put a referral in to the, maternal fetal medicine so you can get a more in-depth ultrasound. And then from there, it's like you wait for that appointment, and now you're Googling and going down the rabbit hole of all the Google. And it's just, I don't recommend doing that either. And then you go to the MFM appointments, and then you're still like weeks out from having a conversation with a team. And I know that that's designed because they want to make sure that the diagnosis is what it is. But I think that most moms want to know like what the most significant thing that could possibly happen. I think they want to know that from the beginning. Yeah. I tell families often, I said, if baby's like super shy in the womb and they don't get a good picture. I said, please just prepare for lip and palate. Prepare for it all. Because when you have baby, you're going to be prepared and you're going to be ready for the worst case scenario. Yeah. I'm using air quotes in case I'm not shown up on this. Like that is the worst case scenario of a cleft, of a cleft journey is like lip and palate. And then when families have, a baby that's born with just a cleft lip or just a cleft palate, it's helpful because I feel like they can breathe a little bit better knowing that, it may not be as difficult as they had researched it to be.
Yeah, I wholeheartedly agree. And the thing that and maybe I could make this a little bit of a mission myself, but I'm so curious about how do we bridge that gap? How because it pains me that, in my own personal experience, that my labor and delivery nurse knew that the baby had, Giselle had a cleft palate. and she still encouraged me to breastfeed. It's like, how do you not, knowing all that I know now, and of course, I was forced to learn all this stuff. So I go back and forth to give a little grace. But that's something that's definitely, especially being here, is how do we bridge that gap? And because we can work as hard as we can create community, we can advocate, we can share stories. The providers can do the most phenomenal surgeries and have the best, speech and language pathologists. But if those primary care people and pediatricians and the people early on don't have the resources or they don't remember, because really they're informed, they just don't remember.
Yeah. And they're just, they're checking off, they're coming in doing their rounds and, sometimes they catch it, sometimes they don't. And not necessarily with the providers, but I think that, we have kiddos that are all over North Carolina. They come from hours away. And there are several hospitals that, we kind of see trends with that babies are coming to us in the NICU, with feeding difficulties because they are not using the right bottle systems. They're giving babies with a cleft palate no valve or no specialty feeder of any kind.
This is going to be my story. How do you work in a NICU?
Yes.
And don't know the feed? That to me is unacceptable. So that to me is unacceptable.
Yes. Jennifer, I'm happy to tell you that Jennifer and I are actively working on a presentation, and we've reached out to many hospitals, birth centers, to set up some education for specifically the hospitals that we're seeing, just kind of locally in the area that are having issues with, just having the right things. Even if you're not 100% informed on cleft, you should be because you're in a hospital, but even if you're not, having the right tools, having the right feeding systems, and then encouraging early referrals to cleft teams. I think that's the other issue that we see a ton is we're getting referrals from peds offices. We're not often getting referrals from birth centers. And to me, that's where we need to backtrack a little bit. And so Jennifer and I are, she's my SLP. We are actively working on some presentations, some educational pamphlets for the nursing staff in NICUs and in birth centers, just so that, if a baby is born with a cleft and you haven't seen a baby born with a cleft in 6 to 8 months or a year, or you're new and you've never seen a baby born with a cleft, we can go to this beautiful binder that this hospital has provided us with. And we're going to flip through it and we're going to say, okay, what do we need to do here for this baby? Oh, we need to start using this feeding system. We need to put a referral in for this cleft team that's, however, close or far from where the family is. So we are trying to do that. But I think that that's something that every cleft team needs to kind of do. They need to look in their surrounding areas and work closely with that. But it's hard. There's a lot of OB offices. There's a lot of pediatrician offices. There's so many of them and not enough of us to be able to do it. And I think that's hard because you're never going to be able to just hit them all and you're never going to be able to reach everybody. But I think we know where most of our babies come from as far as hospital systems and distance and all of that. So we are starting to do more due diligence on tapping into those and making sure that they know how to get in touch with us, what needs to be done, how to feed this baby so that they are not winding back up in the NICU because they are a failure to thrive within, a week of life.
Yeah. Yeah, that's incredible. Any way that we can support and be involved in that, I would love to, because that is something that it's been top of mind for me more recently. It's like we have to fill those gaps.
Yeah.
Thank you, Suzie, for all of your work.
Yeah,
and thank you for being on. I just want to say, I've been begging Suzie to come on. She keeps on like, I'll see you in person.
This is my life. I feel like my cup just runneth over. I try to do too many things, and then I come here and I'm like, this is what fulfills me. Like, it does.
Yeah.
It's not like cliche. I mean, I don't mean to be cliche when I say that. It is what fulfills me. And I'm so happy to be surrounded by like all of these professionals. And then I get to be with moms that like, you're filling all these other gaps that like need to happen and, or need to be filled. And I appreciate you.
Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where Cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive Moms in Real Life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for Cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes. And I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid. And yeah, it's definitely something that you'll want to check out. Thank you all again.